Ethosuximide is a medication used to prevent and control a certain type of seizure called absence or petit mal seizure. It works by controlling the abnormal electrical activity in the brain that occurs during a seizure. It can be taken alone or with other medications. Before taking ethosuximide, make sure to read the medication guide provided by your pharmacist. Take this medication by mouth with or without food as directed by your doctor, usually once or twice daily. If you are using the liquid form, carefully measure the dose using a special measuring device. The dosage is based on your age, medical condition, blood levels of ethosuximide, and response to treatment. Your doctor will start you on a low dose and slowly increase it. It may take several weeks or months to reach the best dose for you. Use this medication regularly at the same times each day to get the most benefit from it. Do not stop taking this medication without consulting your doctor, as your condition may become worse if the drug is suddenly stopped. If your condition does not improve or worsens, be sure to inform your doctor. If you experience drowsiness, dizziness, tiredness, headache, stomach upset, loss of appetite, nausea, vomiting, weight loss, diarrhea, or loss of coordination, it's important to let your doctor or pharmacist know. However, many people using this medication do not have serious side effects. Some people who take this medication may experience depression, suicidal thoughts/attempts, or other mental/mood problems. If you or your family notice any unusual changes in mood, thoughts, or behavior, it's important to tell your doctor right away. Serious side effects such as fainting, swollen joints, severe tiredness, easy bruising/bleeding, pink/bloody urine, or rapid breathing should also be reported to your doctor immediately. Additionally, seek medical help if you notice symptoms of a serious allergic reaction, such as fever, swollen lymph nodes, rash, itching/swelling, severe dizziness, or trouble breathing. Keep in mind that this is not a complete list of possible side effects, so if you notice anything else that concerns you, it's important to contact your doctor or pharmacist. And remember, always consult with your healthcare professional for personalized medical advice. Before taking ethosuximide, make sure to inform your doctor about any allergies you may have. Also, let your doctor know about your medical history, especially if you have liver or kidney disease, or any mental/mood disorders. Be cautious when taking this medication, as it may cause dizziness or drowsiness. Avoid alcohol and marijuana, as they can increase these side effects. It's also important to be aware that liquid forms of this medication may contain sugar and/or alcohol, so if you have diabetes, alcohol dependence, liver disease, or any other condition that requires you to limit these substances, consult your doctor before using this product. If you are an older adult, you may be more sensitive to the side effects of this medication, which can increase the risk of falling. It's important to discuss the risks and benefits of taking this medication during pregnancy with your doctor, and if you are breastfeeding, consult your doctor before using this medication. When taking ethosuximide, it's important to be aware of potential drug interactions that could affect how the medication works or increase the risk of serious side effects. It's important to keep a list of all the products you use, including prescription drugs, over-the-counter medications, and herbal products, and share it with your doctor and pharmacist. Do not start, stop, or change the dosage of any medicines without your doctor's approval. One product that may interact with ethosuximide is orlistat. Additionally, it's important to inform your doctor or pharmacist if you are taking other products that cause drowsiness, such as alcohol, marijuana, antihistamines, drugs for sleep or anxiety, muscle relaxants, and opioid pain relievers. It's also important to check the labels on all your medicines, including allergy or cough and cold products, as they may contain ingredients that cause drowsiness. Be sure to ask your pharmacist about using those products safely. If someone takes too much ethosuximide and experiences serious symptoms such as passing out or trouble breathing, they should call 911 immediately. Otherwise, they should call a poison control center right away. In the U.S., residents can call their local poison control center at 1-800-222-1222. In Canada, residents can call a provincial poison control center. Symptoms of an ethosuximide overdose may include slow or shallow breathing, severe drowsiness, and loss of consciousness. It's important not to share ethosuximide with others. Your doctor may also order lab or medical tests, such as checking your ethosuximide blood levels or monitoring your kidney and liver function, while you are taking this medication. Be sure to keep all medical and lab appointments and consult your doctor for more details. Make sure to take each dose of ethosuximide at the same time every day. If you happen to forget a dose, take it as soon as you remember. However, if it's close to the time for your next dose, just skip the missed one and continue with your regular schedule. Never take a double dose to make up for the missed one. When it comes to storing ethosuximide, it's important to keep it at room temperature, away from light and moisture. If you have the liquid form of this medication, do not freeze it. And remember, it's best to store all medications away from children and pets. When you no longer need this medication or it has expired, make sure to properly discard it. You can consult your pharmacist or local waste disposal company for guidance on how to do this safely. And remember, do not flush medications down the toilet or pour them into a drain unless instructed to do so. If you need more help, call your doctor for medical advice. In the US, you call FDA 1-800-FDA-1088. In Canada, you may call Health Canada 1-866-234-2345. Wishing you good health. Thanks for watching.